Johns Hopkins Lifeline was meant to get patients to Hopkins quickly and safely. We knew we had a good ground-based program, and so we knew we needed a rotor wing program to fill out the entire service.
Apply heading 230, cleared for takeoff.
So we began our collaboration with Stat Medevac now 20 years ago, and it's been a very successful collaboration for all of those 20 years. Stat Medevac had an existing, very high quality, very safe helicopter program. And so we wanted to connect that with our desire to bring Johns Hopkins level of care to the patient. So by adding a Hopkins nurse to the Stat Medevac aircraft and crew, the program really extends our reach as far as we need to go.
I think the most unique thing about what we've got is it's essentially a flying ICU. We've got everything in this aircraft that we would have on the ambulance. We're able to bring that to the patient.
I feel like we get to be a patient advocate. I feel like when we come in, sometimes we're a fresh set of eyes, making sure that we're doing the right thing for the patient at all times. And we provide critical care. We bring Hopkins medicine to the bedside.
The benefit of the helicopter is that we're fast, we're 120 some miles an hour, and it's straight line distance. So it's the same level of care, just quicker.
When it comes to transport medicine, there is nothing as important as the team.
We work with some of the best pilots in the industry.
I flew for 21 years for the Marine Corps. I've flown presidents, I've flown dignitaries, I've flown everybody you could think of, but all that doesn't matter. It's the next flight that matters. And if they don't even have to think about being in an aircraft, and if I can keep them comfortable in the back, then they're able to provide the best medical care that they could possibly provide, and that's what we all want to do.
COVID has changed so many things in healthcare. I think it made us more aware of communicable diseases and how to manage that in the future, and it also gave the flight crews incredible experience in dealing with patients with very, very severe respiratory problems.
It's obviously a very rough day for the patient and their family, and if we can do everything to make that part of their illness or injury as safe and as comfortable as possible, that's very rewarding.
This is the greatest job in nursing that I'm aware of. It's something new every day. It's a new challenge, it's a different patient, it's a different patient population.
We are really now on the verge of developing transport medicine as its own specialty, its own body of research, its own body of equipment, and its own body of medical expertise. That's where we're going in the future, and we're going to do it together.